More than 1 million people in the U.S. are living with a severe form of asthma. Dr. Neil Jain and his patient Melody are here to discuss a new treatment option. Hello, you two.
Hi there.
Hi, good morning.
Dr. Jain, let's start with you. Can you explain the difference between asthma and what's known as severe asthma?
Sure. So, we may all know someone with asthma or may suffer or have experienced asthma symptoms on our own. And most of us sort of have an idea about what asthma is. It's, can cause us to have symptoms of cough, wheeze, shortness of breath, chest tightness. And for decades, we've had treatments which may include inhalers. And there is, in fact, a class of medicines that we use for people that have more frequent symptoms called inhaled corticosteroids. And so for most people, they can control their asthma if they use that kind of medication on a daily basis. People that have severe asthma oftentimes need very high doses of those medications. And despite taking those high doses of medications, they continue to experience symptoms of asthma that may wake them up at night, may cause them to have limitations of their activity. They may miss school or work, and they may have asthma exacerbations, or what are commonly known as asthma attacks, that result in them sometimes going to the urgent care in the emergency department, even sometimes being hospitalized or being put on oral corticosteroids, which can have a lot of long-term and short-term effects, negative effects. And so people with asthma, they just continue to experience these episodes and these symptoms despite taking those daily preventative medications.
Okay, so what does this new treatment option mean for patients with severe asthma?
Yeah, so there is this newer treatment option called Tezspire or tezepelumab echo, which is a different kind of medication. It's what we call a biologic that can help to improve asthma control. This is a medication that's taken as an add-on therapy for those patients that are 12 and above who have uncontrolled severe asthma. And it can help to reduce asthma symptoms, improve lung function, and reduce those exacerbations, regardless of the type of asthma you have. If it's severe asthma, we know that there are some people that will say, well, I have allergic asthma. And some people will say that, there's this term called eosinophilic asthma. And this is a medication that's used for those patients that have severe asthma, regardless of the trigger or regardless of the type of asthma. And so that's one of the real upsides of this newer treatment. As with any treatment, there are the risk for side effects. And so we have to be aware of the risk for those adverse effects like allergic reactions. And so this is a conversation that we have with your healthcare provider or asthma specialist before you start this medication.
And Melody, what has been your experience with asthma?
Yeah, I was diagnosed when I was 14, and at the time it was pretty mild. I just had to use an inhaler just every now and then. It wasn't until my 20s that my asthma got severe. And so over the course of the past 20 years, I've been in the ICU over 60 times, intubated multiple times. My husband and I have had to move states because the air quality wasn't great where we were living. I've had to change jobs. Just a lot of lifestyle changes because of the severe asthma.
Wow, that is really difficult. So what advice can you give to people who have been recently diagnosed or are in need of support?
I would definitely say get an asthma specialist that you work well with. Get a good asthma support team. For me, I belong to a group on Facebook, and they've been a lifeline for me. Get good rest, exercise, we'll really go outside for walks, and follow your asthma action plan, and just celebrate the small victories in life. And for me, I just try to remain positive. And I have asthma, but I definitely don't let it define me.
Oh, really good advice. We appreciate it. And I'm wondering, where can we go to learn more?
Yeah, so there is a website relating to this newer medication called Tezspire. And that website is www.tezspire.com. And there you can learn more about the medication, but also about severe asthma in general.
All right, great. Thank you both so much for being with us. We really appreciate it. And we'll be right back with more Midday Maryland right after this.